Hello and welcome. I am Dr. Anil Joshi. Welcome you to my series Learn Radiology with Dr. Anil Joshi. This series has got multiple lectures. Some are for the radiologist, some are for the general medicine people, and some are for the radiology student and medical imaging technology boys. Different lecture cover different topics, different modalities like X-ray, CT, ultrasound. Now this lecture is about ultrasound physics simplified. Now this series of simplified lecture only covers the basics. They are not extensive lectures. They do not complete all the aspects of the subject. For those who are interested in all these things, they must visit our website or our YouTube channel, which has given extensively these lectures in detail. Now today's lecture is about image display. So again I will tell you, it's ultrasound physics. Out of that, imaging display is a short presentation. Now to start with are the disclosure, acknowledgements and disclaimers. Most of the material here is from our routine teaching files. Now they are coming from different years to our department, from different sources. Every year we use them for teaching purposes. It has come from that. But there may be certain material which is downloaded from the web as a royalty-free material. We acknowledge with thanks all of them from whom we have got this material. Now let's go to the USG Physics Simplified in that image display. Now image display means what we see on the computer. This can be displayed in several ways. Now A mode, M mode and B mode are the three modes out of which we use in radiology, or as a radiologist we are more familiar with the B mode, which is a real-time grayscale display. But we'll see all of them. Let's go to the first M mode. M mode is a horizontal sweep of an oscilloscope calibrated to indicate the distance between the transducer and the reflecting surfaces. So that is what we see in a M mode. Now with A mode USG, only the position and strength of the reflecting surfaces are graphically recorded. In A mode, the strength of the amplitude of the reflective sound is indicated by the height of the vertical deflection displayed on the oscilloscope. Further, with A mode imaging, we are showing graphically how it looks like. Now, these are the label diagrams about the graphical presentation. A mode devices display the voltage produced across the transducer by the backscattered echo as a vertical deflection on the oscilloscope. Now, further, in M mode display, wave spikes are represented with a single beam which passes through the object of different consistency and hardness. The distance between these spikes, for example A and B as it is denoted in the diagram, can be measured accurately by dividing the speed of light in tissues. Now there is a different speed of light in different medias, and that is in a separate topic we have covered. We are given in tabular form how much it is. Now coming to M mode, it displays echo amplitude and shows a position of moving reflectors with the time. Now use the brightness of the display to indicate the intensity of the reflecting signals. Mainly used in evaluation of the rapid motion of the cardiac valves, cardiac chambers and vessel walls. So its main applications are all in cardiology. As a radiologist, we use it for the fetal heart rate and for fetal cardiac assessment. Now comes the details of M mode on graphically. Now let us come to the ultrasound image. When an ultrasound image is displayed on a black background, signals of the greatest intensity appear white because they are by the bright echoes. Absence of signal appear black on the display monitor. Now signals of the intermediate density appear as shades of gray. Now they give you a proper imaging pattern. So on one side there is a white, on one side there is a black, and in between are the gray shades, which gives you a good idea about the organ anatomy. Now strong reflectors are white dots like diaphragm, tendon, bone. They are called as hyperechoic. Weaker reflections are gray dots. Most solid organs, thick fluid is isochronic. Now if there is no reflection, black dots fluid. Now this is usually by the fluid. The black dot, when there is no reflection, indicates a fluid with a cyst like urine, blood. They are all hypoechoic or echo-free. Now what is ultrasound gain? Now every machine we are familiar with the gain. When the image is not giving satisfactory results, we increase the gains. Now let us know what these gain controls are. They increase the brightness. So they increase brightness of the brighter spot also, as well as all gray are raised in proportion. So if we increase the gain, it will be brighter. If we decrease the gain, then it will be a darker one. Gain settings are important because they will give otherwise furious readings. Now if we keep the gain setting wrongly, even an anechoic surface or anechoic media will look like a echogenic. So gain setting is the first thing we must adjust when we start doing ultrasound. Now image display storage. The brightness and contrast settings of the video monitor. They are standardized according to the lighting condition. Interpretation of image and archival storage of images may be in the form of transparencies printed on a film by laser camera and printers or videotapes or through the pace. Now let's come to the end of a small lecture pertaining only to the display modes. We have seen in brief in this lecture, more details are available. However, still, I thank you for giving me your valuable time. Please visit our website for comprehensive and detailed lecture over this topic, also of many more. The addresses are given of the website also and our YouTube channel also. Again, thank you, goodbye, take care, and meet us on some other video. Like it if you, or you can subscribe to channel if you feel the activity needs to be encouraged. Thank you.